Eucrisa is a prescription medicine used to treat the symptoms of atopic dermatitis. Eucrisa may be used alone or with other medications. Eucrisa is not a steroid ointment, so it does not have the side effects of a steroid ointment. Indications. Eucrisa is indicated for topical treatment of mild to moderate atopic dermatitis in adults and pediatric patients 3 months of age and older. It can be used on any skin including the face. It should not be used in your eyes, mouth or vagina. How to use. Apply thin layer to the area of skin that has eczema. Apply it 2 times each day. You should wash your hands after applying it unless you are treating eczema on your hands. You should use it for as long as your doctor has told you to use it. Contraindications. Eucrisa is contraindicated in patients with known hypersensitivity to crisaborole or any component. Warnings. Hypersensitivity reactions including contact urticaria have occurred in patients treated with Eucrisa. Hypersensitivity should be suspected in the event of severe pruritus, swelling and erythema at the application site or at a distant site. If signs and symptoms of hypersensitivity occur, discontinue Eucrisa immediately and initiate appropriate therapy. Side effects. Get emergency medical help if you have signs of an allergic reaction, hives, itching, skin redness or swelling, difficult breathing, swelling of your face, lips, tongue or throat. Stop using this medicine and call a doctor at once if you have severe itching, redness or swelling of the skin where the medicine was applied. Common side effects may include pain, burning or stinging where the medicine was applied.